Just a little bit about psychosis. Psychosis is not an illness in itself, but a symptom of other issues, such as psychological or physical issues, along with substance abuse and extreme stress. Symptoms of psychosis include hallucinations, delusions, and cognitive issues. Hallucinations can involve any of your senses. So you can have auditory hallucinations, meaning that you hear things that aren't there. There are visual hallucinations involving seeing things that aren't there. Also tactile hallucinations involving sensing touch. And even olfactory hallucinations involving sense of smell. Delusions can involve beliefs that don't make sense to others. It can involve attaching too great meaning to happenings, like making connections between coincidental patterns, or believing that you are chosen or special in some way, like that things in the environment specifically relate to you, or that you're being persecuted. Psychosis results from a genetic predisposition towards having psychosis, along with environmental factors. This is known as the Diathesis-stress model, where the diathesis is the genetic predisposition, and the stress is an environmental trigger. An environmental trigger can be extreme prolonged stress, such as is experienced in prolonged childhood trauma. Some early signs of psychosis can include having unusual thoughts that are not swayed by contradictory evidence, withdrawing from relationships with others, feeling unable to think or focus, disregarding self-care, and sensing things that others do not. Psychosis can be a coping mechanism to manage stress. Psychosis involves a retreat from external reality into another reality, leading to changes in the view of reality. Experiences of psychosis, like hallucinations and delusions, can be viewed symbolically, and you can see them as communication from your subconscious. It can actually be helpful to acknowledge hallucinations and delusions. So don't be afraid if you're experiencing psychosis, because it's communication from the subconscious and you can learn from it. It can help to be curious about hallucinations and delusions instead of being afraid. For help in understanding how psychosis is used as a coping mechanism by the psyche, I recommend reading the book The Inner World of Trauma by Donald Kalshed. While psychosis and dissociative disorders can be co-occurring, they are different. Dissociative disorders, like dissociative identity disorder, involve fragmentation of the psyche into multiple senses of self, or multiple egos. Psychosis, on the other hand, involves fragmentation of the ego, so that experiences from the subconscious may be experienced externally instead of internally. Psychosis can happen when the psyche fragments to protect the ego, and the mind retreats from the external dimension into a more symbolic, internal subconscious dimension. This is the same subconscious dimension that Carl Jung talks about in discussing the collective unconscious. Hallucinations and delusions can serve to protect parts of the psyche. For example, they can deliberately scare you to compel a retreat from reality into the relative safety of the subconscious. There can also be comforting hallucinations, such as voices that say comforting things to you, or seeing other comforting things, such as seeing animals. Concerning both hallucinations and delusions, I found it extremely helpful to learn how to hold both realities in my mind at once. So some parts of me would have one view of reality, and then other parts of me would have another view of reality. For example, some parts may believe that a delusion is real, while other parts are not sure whether a delusion is real. In this case, I found it really helpful to not try to argue with myself about whether a delusion or hallucination is real, and instead just to try to accept that it could be real, but it also could not be real, and learn how to hold both experiences in my mind at once. This was really helpful for decreasing tension within my psyche between parts that believe different things and helped me to feel safer overall. I used to try to ignore my hallucinations and delusions when I was aware of them. Instead of ignoring hallucinations or delusions, I've found it very helpful to actually acknowledge them. It can be helpful to be curious about symptoms of psychosis instead of being afraid, to be open to understanding what information is being communicated from the subconscious. This can help you learn more about yourself and how to better take care of yourself. There's also often a lot of hidden symbolic meaning in psychosis. It also really helps to acknowledge and try to lessen if you have any internalized self-stigma regarding psychosis and experiencing psychosis. I found a lot of my struggle was in a stigma that I imposed on myself, and when I learned how to not feel so much stigma towards my own experiences, it became a lot easier to cope with experiencing. Dealing with psychosis does not mean that you're crazy. It does not mean that you're losing your mind. It's possible to live a functional, meaningful, and fulfilling life while dealing with psychosis. For some, psychosis can get better over time. I've definitely seen that in myself, and my psychosis is far better now than it was in the past. Nowadays, I only deal with hallucinations periodically, and I deal with far less delusions than before. For some people, elements of psychosis may remain, even after treatment. But even if an issue still remains, you can always get better at coping with that issue. You can always get better at learning how to deal with experiences such as psychosis. So in that way, things can always get better. And if you or somebody that you know deals with psychosis, I hope this can provide helpful information and help you to know that there are others going through it too.